Hello and welcome to the Return to Work, a Guide for Employee Reboarding webinar with Donna McEntee. Before we get started today, let's go over a few housekeeping items. We would love to hear from you during this session, and we'll do our very best to address your questions as time allows. At the bottom of your screen, you'll find two options to interact with our speakers. You have the Q&A functionality in which you can submit your questions that you would like Donna to address during the session. You also have the chat functionality in which you can give reactions or comments to the content delivered during this session. Without further ado, I'd like to welcome Donna.
What we're going to discuss today is the Return to Work, a Guide for Employee Reboarding. And in the wake of the global pandemic and shifting employer and employee work arrangements, employees are beginning to return to their physical work locations, sometimes occasionally, sometimes part-time, and in some cases even full-time work at a physical location. The health and safety of the workforce should be your top priority as it impacts how you bring operations back online and employees back to some aspect of pre-pandemic normal. Reboarding is the process of helping organizations resume operations, but reboarding goes beyond that task and minimizes health and safety risks as employees return to the workplace. It addresses employees resuming their previous job responsibilities, or it may include training employees for new jobs in your organization. Reboarding also encompasses training new employees to replace those employees who may not be returning to the workplace or supporting your expansion of operations. Employers must also help employees returning to work deal with issues arising from the pandemic. And these are going to include things like extended shutdowns, financial challenges, the safety and health of family members, and also loss and grief. And it may also encompass changes in family obligations for employees. So today we're going to talk about what is reboarding, how does reboarding differ from onboarding, preparing the workplace for returning to work, additional skills needed by managers and in some cases employees, and management's role in assisting employees in the mental health process and recognizing trauma and stress. So first, let's go ahead and take a look at what is reboarding. Reboarding is really shorthand for re-onboarding. In the past, before COVID, it might be the process you followed when temporary employees are brought on full-time or laid off, furloughed employees are brought back to the work environment. This process can help set employees up for success when they rejoin your organization or move into a different role upon returning. In our conversation today, reboarding applies to when you are reopening or restaffing your physical locations after COVID, when employees are returning to work after a layoff or returning to work after working at maybe another company during the pandemic, and employees who have transitioned into a new role within the company. A recent survey conducted by Stanford University reported that 42% of employees were working from home, and many plan to remain at home. CEOs are wrestling with the right time to return and how to encourage employees to return to the workplace. I think we can all agree that the workplace employees are returning to will not be the same workplace they left during the pandemic. It's essential to determine who will and will not be returning to your physical locations. In some instances, employees may have anxiety about returning to your facility due to potential COVID exposure, or they may still have family challenges such as children at home who are still learning remotely. If remaining at home, one thing you should consider is the employees' continued health and safety. One suggestion is to survey employees to determine if they can return effectively to the office, or if they can effectively work from home, if their home environment is conducive to working, and whether they want to work from your physical workplace. As far as safety at home is concerned, consider providing training on general health and safety topics like slips, trips, and falls, ergonomics, and fire safety, as well as other ongoing issues such as COVID-19 requirements, and maybe even add training in for security and violence as well. So how does reboarding differ from onboarding? The onboarding process typically includes completing paperwork for insurance and other benefits, new employee badging, initial health and safety training, medical exams if required, and orientation for the employee to their new job. Reboarding might look similar, but there are a few adjustments that you'll need to make. These can include updating HR documents versus completing the new employee paperwork, ensuring that hazard identification and assessments are up to date with the new facility requirements, and employees are current with their training. You can communicate any job changes that have been implemented since the employees were last in the facility, any new and revised PPE requirements, and expectations for the employees as far as hygiene goes related to COVID. Hazard identification is something you would normally do for all employee positions, and there are 5 actions you take in conducting a job hazard analysis. The first is to break the job down into steps, then identify the hazards for each step, evaluate the hazards. Then once you've completed those steps, you will recommend any safety procedures and protections, and periodically review and update the job hazard analysis for any changes. There are forms available that can help you conduct a job hazard analysis, and it could be deployed electronically and completed by your employees and reviewed by your organization. OSHA has sample formats you can use for conducting the hazard analysis on OSHA.gov, and EPA also has online example templates. The one that you can see on the screen right here is one that is helpful in that the EPA has provided some templates for COVID return to work. So it looks at things like employees who travel and what hazards might be associated with that. So those are some good resources to take a look at some sample templates. Once you've completed the analysis, work with employees to implement the hierarchy of controls. So using the hierarchy of controls, the first step is eliminating the hazard that they might be exposed to in the workplace. Substitution would be the next, replacing the hazard with a non-hazardous object, device, or substance. With COVID, there really is no substitution, but based on your analysis, some of your approaches might change. For example, an employee may take a car service to a meeting versus public transportation to reduce their risk of exposure. Then there are engineering controls. These are changes in equipment that can isolate people from the hazard. An example of an engineering control might be increased ventilation through the HVAC system. Then there are administrative controls. These are process and policy changes that impact the way people work and eliminate or reduce exposure to the hazard. And a lot of the COVID-19 controls will fall under the administrative section. And then personal protective equipment. And this is what employees wear to protect themselves from hazards. Anytime that you do a hazard analysis, be sure to keep documentation for the duration of the employee's employment and longer if possible. Once you've assessed what the safety and health measures and controls should be implemented, if employees cannot continue to work from home or cannot be physically distant at work, those activities should only be performed if they're essential and additional controls are implemented, such as additional ventilation and PPE. The next thing you should consider for reboarding would be physical workplaces, and the primary concern here is that they're clean and safe. So before employees return, one recommendation would be to deep clean facilities if needed. So if facilities have been closed for a significant amount of time, a deep cleaning might be needed. And then let's talk about disinfection. This has been a topic that there's been a lot of analysis around and reporting around. The CDC cleaning guidance has been recently revised. People can become infected if they touch surfaces and then touch their nose, mouth, or eyes after touching a contaminated surface. So if an employee was in an office, coughed and sneezed and left droplets on a desktop, another employee could come in, touch that surface, and potentially become infected with COVID. Still, in most situations, the risk of infection from touching a surface is low. The most reliable way to prevent infection from surfaces is for your workers to wash hands and use hand sanitizers regularly. Always follow standard practices and appropriate regulations specific to your type of facility for minimum standards for cleaning and disinfection. So this is general guidance for buildings and community settings, and this guidance is not intended for healthcare setting or other facilities where specific regulations and practices for cleaning and disinfection apply. So the general guidance from CDC is when no people with confirmed or suspected COVID-19 are known to have been in a space, cleaning once a day is usually enough to sufficiently remove virus that may be on surfaces and help maintain a healthy facility. Cleaning should be done with products containing soap or detergent that reduces germs on surfaces. Removing contaminants may also, cleaning removes contaminants by weakening or damaging some of the virus particles, which again decreases the risk of infection from surfaces. There's also the U.S. EPA recommended list of cleaning agents, and it's available on the EPA website if you have questions about what disinfectants to use. Ventilation is another way that you can improve the safety within your facilities, and it should be increased if possible through the HVAC system, or another way would be to allow employees to open windows and doors to increase ventilation if that is safe in your facility. Consult with an HVAC professional and your building management team to maintain a relative humidity of between 40 and 60%. And ensure when employees are changing filters that they wear the appropriate personal protective equipment, such as an N95 respirator, eye protection, and disposable gloves. Another suggestion is to make sure that exhaust fans in restrooms are fully functional and operating at maximum capacity. I would also recommend that they just remain on. You can also enforce physical distancing in your facility or install barriers, but be sure to do that without introducing additional hazards. And this will be part of the job hazard analysis that you conduct. Ensure that employees are not negatively impacted by barriers, and this would include employees with physical limitations or physical disabilities. So make sure that any changes are inclusive for all employees. And the next reboarding would be training. There are many OSHA standards that explicitly require employers to train employees in health and safety aspects of their jobs. New employees must receive initial required OSHA training before the employee begins work or is at risk to exposure to a hazard. You must provide the training during regular working hours and at no expense to the employee. Consider new options for training. And as we all know, virtual meetings are very common now. Employees are used to participating in those. So if training can be done virtually before the employees return to work, that would be one option. Moving content online so that employees can access it at their convenience, or only using small group training sessions that incorporate social distancing. Those are some options to provide the training to the employees. The training must cover all hazards the employee may be exposed to, and this would include COVID. You have to keep training records. As we'll see, with onboarding, this may keep you from retraining employees. So in the past, if you haven't kept good training records and you cannot prove that employees have been trained on specific topics, then you may need to do retraining like you would have done as far as a new employee goes. So do their initial OSHA training. If you have training records and it meets the requirements, refresher training may meet the need from a regulatory perspective. And remember, after the employees receive their initial training, if there's any additional training and retraining, it must occur when a new hazard is introduced. So refresher training must occur as required, and as you reboard employees, ensure that all of their training requirements are up to date. One of the best ways to manage training is by creating a employee training matrix. And this can be created after you've completed the hazard analysis. The training matrix will help you define what training employees are required to have and how often it should be completed in case there are refresher and retraining requirements. It also allows you to group training by specific job functions or by individual employees. So as a takeaway from this session, we're going to provide you with a sample training matrix. Next would be medical considerations. So this is definitely not an all-encompassing list of medical considerations, but maybe a few of the more common requirements. First is with respiratory protection. As you reboard employees, ensure if they are required to use a respirator, ensure that their respirator fit tests are current and their training is current. Note that a face mask or a surgical mask is not considered respiratory protection. Wearers of respirators do require proper training, fit testing, medical evaluations, and monitoring. They also need to be familiar with equipment cleaning, and you'll need to keep appropriate records for employees that wear respirators. If your employees work in healthcare or may be exposed to hepatitis B, ensure that their vaccinations have been provided after employees receive their OSHA training, and typically within 10 working days of their initial assignment. Ensure that employees are trained on TB if they have a potential for exposure. Another thought is employees may make COVID-19 vaccine or vaccination series available at no cost to all eligible employees. You should provide information and training on the benefits and safety of vaccinations. As the employer, you cannot distinguish between vaccinated employees and those who are not. Currently, OSHA recommends that employees who are vaccinated continue to follow protective measures such as wearing a face covering and remaining physically distant. However, this is contrary to current CDC guidance and may differ from state and local guidance, and guidance has been changing on almost a daily basis recently. So make sure that you're up to date with the most current guidance from federal, state, and local entities. CDC's current guidance was recently relaxed, and many of its COVID-19 safety recommendations have been updated. CDC says that fully vaccinated people no longer need to wear masks in many indoor and outdoor settings, though exceptions apply in some circumstances. So again, verify those requirements for your location. And one other item as far as masks vaccinations are concerned is previously employers were required to record adverse reactions to the COVID vaccine on the OSHA 300 log. As of May 21st, OSHA guidance says that employers no longer need to record worker side effects from the COVID vaccines through May 2022. So that's another recent update. So when we look at preparing your workplace for return to work, the first step would be to create a plan. And one thing you should consider would be the external and internal risks to your organization. For example, for external risks, what does COVID-19 look like in your community? What are the vaccination percentages? How many current cases are there? Do your healthcare facilities have capacity if there is another outbreak? And these are all factors to consider when bringing employees back into the workplace. Another would be internal risks as far as how has COVID spread in your facility in the past and what actions would you need to take to limit that? Can you limit the spread of COVID in your facilities? Or look at other facilities in your organization or in your area. Have they had outbreaks of COVID? How are they able to stop that? What controls did they put in place to limit the spread? And then think about your facilities in general. Do you have room for social distancing when the employees return? Is there adequate sanitation and hand washing facilities? Do you need to rethink the design and layout of your facilities to accommodate COVID-19 controls? And what about employees who are vaccinated and those who are not? How will you address that? Some of this will be guided by local requirements. There's also guidance available through OSHA on return to work. So that should just be part of your consideration when you're planning how to bring people back. And employers really should implement a COVID-19 prevention program. Any programs that you create should include and engage your employees. Also consider the union representatives and other community representatives in your plan. Anyone who's working on your planning for returning to work should know how to conduct a hazard assessment. You should also identify a combination of measures that limit the spread of COVID in the workplace. Ensure that policies are in place to ensure that you can separate ill employees from other employees and be able to send ill employees home from the workplace. You should be able to implement protections from retaliation for employees who raise COVID-19 related concerns. And there's some very good guidance documents that I'll provide a reference for at the end of the session that are going to help you with the specific steps to take to accomplish that plan. As I mentioned earlier, it may be valuable to survey employees on their return to work preferences. In a recent Fast Company article, an example that was shared was where a CEO suggested that workers could lose benefits such as health care if they insist on continuing to work remotely as the COVID pandemic recedes. The staff reacted by refusing to publish for a day, and then the CEO had to apologize for the misstep. So another recent survey of full-time corporate and government employees found that 2/3 say that their employers have either not communicated a post-pandemic office strategy or have only vaguely done so. Review current work-at-home policies and let workers know beforehand when you will shift to in-location work. First, create the plan and involve the management and employees in the discussion. Based on the hazard assessments, how will you handle potential new risks for your employees? How will you implement changes for physical distancing? Are there ways that you can encourage employees to do things in a different way, such as use stairways instead of elevators? Identify changes in how work will be conducted, including interactions between employees and customers. This may even be the use of break rooms, common areas, and common equipment. Will conference rooms be available? How many employees will be allowed? What about the receipt of packages and materials or delivery of goods and services? If possible, continue to track who has worked, which shifts, locations, and contacts between employees and customers. Contact tracing may still be needed if you have outbreaks of COVID in your facilities. Plan for ongoing evaluations. How are the changes you implemented working? Have you identified areas that need improvement? The next step is communication. Employers should frequently communicate with their employees. This includes general communications and new policies to be followed. These are things like general safety measures and controls, how they are expected to work, when employees are expected to be at their physical location, and how to report safety concerns. Use formal and informal methods. Communicate with employees in a manner that will help them understand. And this should also be considered from the perspective of the language that employees speak, and also if there are any concerns with their ability to interpret written and auditory instructions. And next, evaluate the precautions that will need to be put in place. If you have unvaccinated employees in the workplace, protect your employees and have masks, tissues, and hand sanitizers available. Ask your employees not to come into work if they think they've been infected. Have policies and procedures in place that allow employees to stay at home if they think they may be infected or if they are infected. Ask them to isolate or quarantine at home. If you have employees at increased risk for severe illness, such as older adults, people with chronic illnesses, pregnant employees, consider developing policies and practices to reduce risk at work, like working from home, separated workspaces, or modified job responsibilities. Again, you can further reduce risk by installing barriers in the workplace and minimize the in-person interactions of employees and customers. You can still encourage mask wearing and social distancing, and encourage employees to reduce the amount of time spent with other individuals in the workplace. Okay, next, let's look at upskilling and reskilling. In many industries and regions within the country, we're facing a shortage of employees. It may be hard to attract employees in a tight labor market, and many in-demand jobs may be hard to fill. Consider promoting or reskilling existing employees to take on leadership roles. This may require training in management and leadership skills, as well as encouraging employees to become safety leaders in the organization. But promoting from within has many advantages, such as lower cost per position. A recent Wall Street Journal article shared that replacing an employee can cost 20% to 30% of an annual salary on average. By contrast, retraining an employee costs less than 10% of annual pay. In addition to any training requirements imposed by specific standards, employee training is one way an employer can meet their general responsibility under the OSHA Act for preventing violations. In the absence of specific requirements, the type of training that should be provided will be measured by what a reasonably prudent employer would do in the circumstances. For example, provide training in a language and a manner that the employee can understand to employees on COVID-19, personal hygiene, your policies and procedures related to COVID. As always, document any training provided. If you've developed or revised operating procedures, communicate these to employees and document employees' attestation to reviewing those procedures and agreeing to follow operating, safety, and health requirements. Be sure that anyone involved in determining training requirements is up to date with current COVID regulations and OSHA requirements. And consider the upskilling and reskilling managers by cross-training. There's always a possibility that employees will continue to be out due to COVID, or they may need to take care of family obligations. Implement a skills assessment to determine where there are gaps in manager and supervisor skills. And for new managers and supervisors, consider providing training on essential skills like communication, software tools that they use, anti-harassment, and diversity in the workplace. Managers should also receive training on mental health first aid and learn to listen actively to employees and encourage them to seek assistance when needed. Our current public health guidelines, such as social distancing, can make people feel isolated and lonely, and it can lead to increased stress. Some signs of increased stress include fear and worry about their health and that of their loved ones. Employees may be stressed about job security, their personal finances, or loss of support services that they have once relied on. They may have difficulty concentrating or lose focus. They may be suffering from sleep disruptions or difficulty sleeping, or may have developed unhealthy eating patterns. Employees are also suffering from chronic physical and mental health problems and may even increase their use of tobacco, alcohol, and other substances during the pandemic. Every employee reacts differently to the stress caused by the pandemic. People who lose a friend or family member to the disease will grieve and may experience a wide range of emotions that are going to take time to process. And then people that are at higher risk for contracting COVID may experience more anxiety. Of course, many other groups are vulnerable to increased stress and anxiety, such as unpaid family caregivers, even family members like children and teens, and those with existing mental health conditions. Actively listening to employees will help them open up to you about emotional and mental concerns. It's important not to interrupt a person when engaging in active listening or preempt what they are going to say. Encouraging employees to seek assistance or treatment is a crucial part of first aid for mental health and responding to mental illness in the workplace. Employees may be hesitant to seek treatment for a variety of reasons, and it's important to encourage all employees to seek the help they need. In the event of a crisis, help the employee get immediate assistance. So we've covered a lot of material today, and I want to summarize those steps about reboarding employees. First, evaluate the hazards employees are exposed to at work. This includes COVID-19 now. Eliminate those hazards, substitute where possible, and use engineering and administrative controls. And PPE is also your last resort to keep employees safe. Ensure physical workplaces are clean and safe. After reopening facilities, they may need to be cleaned and have additional ventilation added. Review returning employees' training records and provide any new or refresher training that's required. Confirm all medical requirements such as respirator fit tests and medical assessments are current. Create a plan for employees to return to work. Involve managers, supervisors, unions, and employees in the development of any reopening plans. And communicate frequently, both formally and informally, with employees to keep them informed of your reopening plans and any changes that will be implemented in the workplace. Continue taking precautions, as not all employees will be vaccinated. You may also have some employees at higher risk. Work with all employees to ensure that they are able to return to work safely. Look for opportunities to reskill and upskill employees and managers to fill gaps and take on new roles in the organization, and provide training to them to make them successful. Be very aware of employees' mental health. Encourage employees to seek assistance or treatment. Make sure managers are familiar with mental health first aid and their response to employees in the workplace. Employees may be hesitant to seek treatment for a variety of reasons, so it's important to encourage all employees to seek the help that they need. And finally, just a few resources, and we'll share a list after the session today, but I wanted to mention the ASSP ISO, Occupational Health and Safety Management, Safe Working During a COVID-19 Pandemic. This is a general guideline for organizations, and it's a great reference to help you get started in the planning portion of returning to work. And then, as I'm sure many of you are familiar, the CDC has great resources available on their website, as well as OSHA. They have COVID guidance for return to safe work and OSHA COVID-19 ventilation guidance as well. So I want to thank everybody for joining today. I hope you got some important information from this session, and I appreciate your participation.
Wow, thank you, Donna. We do have some questions from the audience. Our first question, Donna, is what are some of the most critical training courses we should consider providing for reboarding?
That is a great question. I think I would definitely start with COVID training to ensure that all employees are, aware of sort of the scope of COVID, the signs and symptoms of it, how it should be handled in the workplace, and then if you are sick, what the best practices are. I have a feeling most people have received at least some training on that, so you may want to consider doing maybe a refresher training for COVID, just to make sure that everybody is on the same page. In addition to that, first aid mental health is a great topic, especially for managers and supervisors. I think I saw one question that came in about that. If you're going to do, you think about first aid for injuries in the workplace. How do you treat a cut? How do you treat somebody that may have, fallen in the workplace? But we really don't do a whole lot of training on first aid for mental health issues. So, thinking about training, your supervisors, your managers on what, some of those issues are, recognizing what some of those issues are in the workplace, and how to specifically work with employees around those. So recognizing and then making, recommendations for treatment, or, encouraging employees to seek help, I think would be a great addition to the training that you do, in addition to all of your, your required OSHA training, as well as any refresher training that you need to do.
Great, thank you so much. I see another one in here. It says, does Skillsoft provide training courses for the mental health first aid?
We do. We have an online course for first aid for mental health awareness. Yeah, and it's a great addition, to your typical first aid awareness level courses.
Great, thank you. We definitely have other questions coming in. Our next one, should I make any accommodations to my return to work plan in response to the COVID-19 Delta variant?
I think if you created your plan with coverage for outbreaks of COVID, I don't see that you would need to make any changes at this point. I think what I would recommend is follow the guidance that's coming out from the local level as well as the CDC. I've read some reports where masks are either being encouraged or in some cases are now required in some communities. So you're going to have to look at that again. But definitely, yeah, keep a pulse on what is current with Delta and what the best recommendations are around that. And I do think at some level you'll need to incorporate some of that information into your plan.
The next question is, as employees return to the workplace, they may have mental and physical health issues that require work accommodations. What are some of the best practices for keeping open lines of communication as employees return to the workplace?
That's another great question. So as we know, the pandemic's been hard on everybody, and as employees come back, it could be any number of things. Maybe the employee has had COVID and they're now considered a long haul COVID, person. I saw a report I think maybe this past week where they think that maybe 26% of the people who have had COVID will have some long haul issues. That could be everything from, fatigue to respiratory issues to maybe even depression as a result of it. So again, communicate with your employees to share that information with you, in a respectful way, and acknowledge that this is medical information. So be careful around, those conversations. But with them sharing that information with you, you can make accommodations or adjustments to their work environment as needed.
Our next question is, OSHA's emergency temporary standard is focused on healthcare. What should other industries be doing?
I think, if you are in the healthcare industry, you are probably aware whether you fall under the NAICS codes or not. If not, if you're unsure if you fall under that, first thing I would do is just confirm, where you fall under the emergency temporary standard. The other thing would be to take a look and see where OSHA is expanding their inspections in some other work environments. So check with the latest information from OSHA to find out if your industry is also under a microscope at this point, as far as the potential for increased inspections and focus for health and safety issues. So I would start with that. And then, knowing your employees and knowing the hazards that you have in your environment, be sure that you are up to date with all of the requirements from an OSHA perspective, and, CDC guidance, such as social distancing, putting in barriers, providing personal protective equipment, and making sure the employees are trained on it as needed, and, provide those options for the employees to make sure they're as safe as possible.
Donna, our next question is, I'm seeing reports of employees not embracing returning to the workplace 5 days a week. What are best practices for addressing employee hesitancy to return?
I think definitely a conversation with those employees. Is there reluctance to come back to the workplace? Is it based on the fact that either they're not vaccinated, or that maybe coworkers may not be vaccinated? Is it a situation where they have childcare issues at home, or maybe they're taking care of a family member? I really think, getting to the root of the hesitancy to return will go a long way. And then work with those employees to come up with a plan on how best to bring them back into the workplace. I think right now, one of the key words that we should all be thinking about is flexibility. We would like it to go back to the way it used to be, and as quickly as possible. But I think we need to be aware that there's so many variables and circumstances on an individual basis that will need to either be addressed or have a conversation with employees around to make them feel comfortable about coming back into the workplace.
And stemming off of that, response there. Our next question are, what are the protocols if someone does not feel comfortable going back to work in the face-to-face environment and wants to stay virtual or telework environments?
Yeah, again, it's going to depend on the individual facility or business. If possible, have that conversation with the employee, find out why they're not comfortable. And if they can come back into the workplace, what would make them comfortable in that environment. It may also be an issue of developing, maybe some additional administrative guidance for employees, and make sure you communicate ahead of time. Example, we expect to fully reopen offices by September 1st. As you can send out that message. For any employees that may have issues, please let us know and we can discuss that. Again, it's the flexibility, I think, at this point, to bring those workers safely back into the workplace.
Donna, do you see
Sure.
anything else that you would like to comment on?
Yeah, I wanted to comment or share one comment on the return to work and reopening facilities. If there's one thing that's come up recently is, for example, schools are going to be reopening soon. And those types of facilities that have been closed either for an extended period of time or have had limited use. Legionella has been an issue in some buildings. And there's also been some recent information around clearing water systems of lead and other contaminants in the water system. And I've not seen much conversation in the safety and health area around this. So I just wanted to bring that up is, if you're responsible for facilities or maintenance of facilities, to really look closely at the water systems, so that the pipes are flushed, the water's clean, and even do, maybe some testing on drinking water if possible. And, again, as I mentioned, these are buildings that are being reopened or have had very limited use. So it could be things like, Legionella, lead in the system, those types of things. So just another consideration as you're reopening your facilities.
I believe we have time for one more question. What do you believe training courses should look like for the different flexible work, full-time in office, part-time in office, remote, full-time?
That's a good one. When you ask what should they look like, I think they should be specific to the work environments. So if you have employees who are working still from a home office, at least, part-time or maybe even full-time, provide training specific to the home office environment, which would be different than, working in a facility or an office building space. They may need to be trained on both. So if they're going to be co-located, 3 days a week at home and then 2 days a week in the office, you would want to make sure that they're trained on the hazards in both situations, just to make sure they're covered, because there are some differences. So I would look at it from that perspective. And I would also share any corporate, policy and procedures that you require employees to be aware of as a part of that training.
Fantastic. Well, thank you so much, Donna. This has been a really great conversation. And again, you'll be receiving a copy of the PowerPoint slides. You will receive a copy of the recording from today's session. So we appreciate you spending your time with us. And we hope that you have a great, wonderful rest of your day. Thank you.